Collagen supplements.
Hi, my name is Dr. Xavier, or Dr. X for short. Welcome to my channel. In this channel, we're going to talk about longevity medicine, anti-aging medicine, aesthetic medicine, hormone therapy, supplements, nutrition, anything to do with anti-aging and healthy aging. So welcome to my channel and enjoy today's video. Hi, welcome to today's video. Today I would love to talk about oral collagen supplementation. This is a subject I get asked a lot about. People ask me all the time, should I take collagen supplements? Should I take collagen liquids in liquid form? Should I take collagen capsules or tablets? Or should I apply collagen containing creams onto my face? And if I do that, will that collagen end up in my skin? So let's try and break it down to see if there is actually any benefit for taking collagen supplements. So your skin obviously consists of many substances, including collagen, but collagen is probably the most abundant protein in the skin. If you look at dry skin, you're probably looking at 70 to 80% of your dry skin weight being collagen, and collagen is of course made within the skin. So in your skin, in the middle section of your skin, which is called the dermis, you have specific cells called fibroblasts, and these cells create collagen. They also create elastin, and they create hyaluronic acid. So these are the three substances, the main three substances that create what we call the extracellular matrix within the dermis, and that is what keeps our skin very, very youthful. Now, as we age, so once you get to 25 plus, 30 plus, the fibroblast activity drastically reduces, which means that you're not creating a lot of collagen, elastin, or hyaluronic acid in the skin. So your dermis becomes thinner and drier, and that is the natural aging process. So if you take collagen supplements, is it going to end up in your skin? Is it going to help? So when you take collagen, whether it's in liquid form or capsule or it's in a topical form, it's, especially if you're ingesting it, of course, that collagen has to go through the digestive tract, obviously. So it will get broken down to its components. So if you're applying collagen topically on top of your skin, the collagen molecules are far too large to actually penetrate into the skin. So they're really not going to do too much inside of the skin layers. They may temporarily hydrate the surface layers of your skin, but really they're not going to go into the skin. When you take it orally, collagen is going to get broken down into its components, which are amino acids. So the three main amino acids, you've got glycine, proline, and hydroxyproline. These are the main three amino acids that collagen consists of. And you just need to think for a moment, when you have digested collagen, the supplement that you've taken, it gets broken down to the amino acids, and those amino acids are going to go into the bloodstream, because that's how your digestive tract works. So it absorbs nutrients through the bloodstream, and those amino acids will then have to somehow end up in your skin, and specifically in your face, okay? So there is some evidence that taking collagen supplements generally helps with your health and of course with the way your skin looks, but really I don't believe that if you take a collagen supplement that it will end up directly in your skin, specifically in your face. So should we take them or not? I think the first thing we need to look at is our nutrition. When we are choosing what we're eating, are we actually getting enough protein in our nutrition? Because protein consists of amino acids. So if you want to have enough amino acids in your body to allow your body to create its own collagen, then of course you need to eat enough protein. And unfortunately, most of us do not eat enough protein on a daily basis. Okay, so especially if you're on a weight loss diet, especially if you're maybe vegan or vegetarian, you may have problems getting enough protein and amino acids in your diet, and you do need to take supplements to make sure that you have enough protein coming in on a daily basis. Because if you're not taking enough protein, then your body needs that protein and needs to take it from somewhere else, and it will start breaking your muscle tissue down, which consists of protein, amino acids, and it will need to use it for other things, to rejuvenate, to regenerate, and to create new things. So if you think of it logically like that, yes, taking a collagen supplement may help because you're giving your body all the amino acids that it requires to create more collagen. But is that enough? If your fibroblasts are dormant and not really active, giving them collagen supplements and therefore the amino acids may help a little bit, but it's not really going to create a lot of collagen in the skin just because you're taking those supplements. So what would be best is if you have treatments that induce collagen production in the skin, treatments such as microneedling or devices that help to stimulate the skin, or biostimulatory products such as Sculptra or Elancet or Radiesse, or you have regenerative products such as polynucleotides and exosomes, chemical peels for example. So things like that. If you have those treatments that are stimulating your fibroblasts to create more collagen, then yes, it does absolutely make sense that you give your body the nutrients that it needs to create that collagen very easily, because then your body has an abundance of those amino acids and it can easily use them. Okay, so taking a collagen supplement on its own is probably not very anti-aging, but it definitely will help as adjunct therapy with your other treatments. The other thing that is important, of course, is having enough minerals and vitamins in your diet. For example, vitamin C is really important for the production of collagen. Without vitamin C, your collagen production will drastically drop down. And some minerals such as copper, zinc. So these are also important to allow your body to create enough collagen and replenish what it has lost. So if you think about the aging journey, when you get to 30, 35, 25, depending on who you are, the aging process has already kicked in. Your fibroblasts are calming down, they're not producing as much collagen, so therefore they need to be stimulated. So you could maybe start with something as simple as using a retinoid cream at nighttime on your face, because we know that retinoids force the fibroblasts to wake up and to create more collagen. And of course, by all means, start taking a collagen supplement then as well, and then you will see better results. So, bottom line, collagen supplements, yes, help to replenish nutrients in your body, but they don't replace good nutrition, macronutrients and micronutrients. So it's very important that you address those issues as well. So I hope you found this very useful, and if you like this video, please like and subscribe, and I will be back with many more videos. Have a great day. Bye-bye.